Breast cancer is a complex disease that often requires a multifaceted approach to treatment. One crucial aspect of breast cancer therapy is hormone therapy, which targets the hormones that can fuel the growth of cancer cells. Hormone therapy is particularly effective in hormone receptor-positive breast cancers, where the cancer cells have receptors for estrogen or progesterone. By blocking or suppressing these hormones, hormone therapy can help slow down or stop the growth of cancer cells. Two widely used medications in hormone therapy for breast cancer are tamoxifen and anastrozole. These medications are often prescribed to postmenopausal women with hormone receptor-positive breast cancer, but the choice between tamoxifen and anastrozole depends on several factors, including the patient's menopausal status, tumor characteristics, and individual preferences. In this video, we will explore the mechanisms of action, side effects, and overall effectiveness of tamoxifen and anastrozole to help healthcare professionals make informed decisions. Tamoxifen. How it works and its benefits. Tamoxifen, a selective estrogen receptor modulator, SERM, has been a cornerstone of breast cancer therapy for decades. It works by binding to estrogen receptors in the breast tissue, blocking them from receiving estrogen signals. This prevents the estrogen from stimulating the growth of cancer cells, effectively halting their proliferation. Tamoxifen is typically prescribed for both premenopausal and postmenopausal women with hormone receptor-positive breast cancer. One of the key advantages of tamoxifen is its versatility. It can be used as an adjuvant therapy to reduce the risk of cancer recurrence after surgery or as a primary therapy to shrink tumors before surgery. Additionally, tamoxifen has been shown to reduce the risk of developing contralateral breast cancer in women with hormone receptor-positive breast cancer. This makes it an attractive option for patients who are concerned about the potential for cancer in the unaffected breast. However, tamoxifen is not without its drawbacks. It is known to increase the risk of endometrial cancer and blood clots, which can be serious complications. Regular monitoring and follow-up are essential to detect any potential side effects early on. Other common side effects of tamoxifen include hot flashes, vaginal dryness, and mood swings. Despite these potential side effects, tamoxifen has a proven track record of efficacy and is considered a gold standard in hormone therapy for breast cancer. Anastrozole. How it works and its benefits. Anastrozole, an aromatase inhibitor, takes a different approach in hormone therapy for breast cancer. Unlike tamoxifen, which blocks estrogen receptors, anastrozole suppresses the production of estrogen in postmenopausal women. It achieves this by inhibiting the enzyme aromatase, which is responsible for converting androgens into estrogen. By reducing the available estrogen in the body, anastrozole starves hormone receptor-positive breast cancer cells of the hormone they need to grow. One of the significant advantages of anastrozole is its effectiveness in postmenopausal women. Since it targets the production of estrogen, it is most effective when the ovaries are no longer producing significant amounts of estrogen. Anastrozole is often prescribed as an adjuvant therapy after surgery or as a primary therapy for advanced breast cancer. It has been shown to significantly reduce the risk of cancer recurrence and improve disease-free survival rates. Like tamoxifen, anastrozole has its share of side effects. Common side effects include joint pain, muscle stiffness, and bone thinning, which can increase the risk of fractures. However, anastrozole does not carry the same risk of endometrial cancer and blood clots associated with tamoxifen. This makes it a preferable option for patients who may be at higher risk for these complications. Overall, anastrozole offers an effective alternative for postmenopausal women seeking hormone therapy for their hormone receptor-positive breast cancer. Key differences between tamoxifen and anastrozole. While both tamoxifen and anastrozole are effective hormone therapy options, they differ in their mechanisms of action and potential side effects. Tamoxifen, as a selective estrogen receptor modulator, blocks estrogen receptors in the breast tissue, while anastrozole, as an aromatase inhibitor, suppresses the production of estrogen in postmenopausal women. This fundamental difference influences their use in different patient populations. The choice between tamoxifen and anastrozole depends on several factors. For premenopausal women, tamoxifen is often the preferred option, as it can be used to block estrogen receptors regardless of ovarian function. In contrast, anastrozole is most effective in postmenopausal women, as it relies on low levels of estrogen production for its efficacy. Additionally, the presence of other risk factors, such as a history of blood clots or endometrial cancer, may influence the choice of medication, as tamoxifen carries a higher risk for these complications. It is important to note that individual patient preferences and tolerability also play a significant role in the decision-making process. Some patients may have a strong aversion to potential side effects such as hot flashes or joint pain, while others may prioritize the reduction in the risk of contralateral breast cancer. Healthcare providers must carefully consider these factors and engage in shared decision-making with their patients to ensure the most appropriate treatment choice. Side effects of tamoxifen and anastrozole. As with any medication, both tamoxifen and anastrozole have potential side effects that need to be considered. Tamoxifen is known to increase the risk of endometrial cancer and blood clots, although these complications are relatively rare. Regular monitoring and follow-up are crucial to detect any early signs or symptoms and manage these risks effectively. Common side effects of tamoxifen include hot flashes, vaginal dryness, and mood swings, which can significantly impact a patient's quality of life. On the other hand, anastrozole is associated with side effects such as joint pain, muscle stiffness, and bone thinning. These side effects are primarily due to its impact on estrogen production in postmenopausal women. While they may be bothersome, they are generally manageable with appropriate interventions and lifestyle modifications. Anastrozole does not carry the same risk of endometrial cancer and blood clots as tamoxifen, making it a more favorable option for patients with specific risk factors. Patients should be educated about the potential side effects of both medications and empowered to report any unusual symptoms promptly. Healthcare providers play a crucial role in monitoring and managing these side effects to ensure optimal patient outcomes and adherence to therapy. Choosing between tamoxifen and anastrozole. Factors to consider. The choice between tamoxifen and anastrozole should be based on a comprehensive assessment of the patient's menopausal status, tumor characteristics, and individual preferences. For premenopausal women, tamoxifen is often the recommended option, given its ability to block estrogen receptors regardless of ovarian function. However, for postmenopausal women, anastrozole may be the preferred choice due to its effectiveness in suppressing estrogen production. Other factors that may influence the decision include the patient's risk profile for endometrial cancer and blood clots. Tamoxifen carries a higher risk for these complications, making anastrozole a more suitable option for patients with specific risk factors. Additionally, patient preferences and tolerability should be taken into account, considering potential side effects such as hot flashes, joint pain, or muscle stiffness. Engaging in shared decision-making with the patient ensures that the chosen therapy aligns with their individual goals and concerns. It is essential to emphasize that the choice between tamoxifen and anastrozole should be made in consultation with a healthcare provider specializing in breast cancer therapy. They have the knowledge and expertise to guide patients through the decision-making process, considering the latest research, clinical guidelines, and individual patient factors. By working together, healthcare providers and patients can make well-informed decisions that optimize treatment outcomes and patient satisfaction. Alternative therapies for breast cancer. While tamoxifen and anastrozole are standard options in hormone therapy for breast cancer, there are alternative therapies available for patients who may not tolerate or respond well to these medications. One such alternative is fulvestrant, a selective estrogen receptor degrader, SERD. Fulvestrant works by binding to and degrading estrogen receptors, effectively blocking the action of estrogen on cancer cells. It is typically used in postmenopausal women who have progressed on tamoxifen or anastrozole. Other alternative therapies include aromatase inhibitors such as letrozole and exemestane, which work similarly to anastrozole by suppressing estrogen production. These medications may be considered in cases where anastrozole is not well tolerated or ineffective. Additionally, targeted therapies such as CDK4/6 inhibitors, such as palbociclib and ribociclib, in combination with hormone therapy, have shown promising results in advanced breast cancer. The choice of alternative therapy depends on various factors, including the patient's treatment history, tumor characteristics, and individual preferences. Healthcare providers specializing in breast cancer therapy can provide valuable insights and recommendations based on the latest research and clinical experience. Consultation with a healthcare provider. Choosing the right hormone therapy for breast cancer is a critical decision that requires careful consideration of various factors. As healthcare professionals, it is our responsibility to ensure that patients receive the most appropriate and effective treatment based on their individual needs. Consulting with a healthcare provider specializing in breast cancer therapy is essential to navigate the complexities of treatment options, understand the potential benefits and risks, and make informed decisions. During the consultation, the healthcare provider will assess the patient's menopausal status, tumor characteristics, and overall health. They will discuss the available treatment options, including tamoxifen and anastrozole, and provide detailed information about their mechanisms of action, potential side effects, and overall effectiveness. The healthcare provider will also address any specific concerns or preferences the patient may have, engaging in shared decision-making to ensure the chosen therapy aligns with the patient's goals and values. Regular follow-up appointments will be scheduled to monitor treatment response, manage side effects, and adjust therapy as necessary. Open communication between the patient and healthcare provider is crucial throughout the treatment journey to optimize outcomes and ensure the patient's well-being. Conclusion: making informed decisions about breast cancer therapy. Breast cancer therapy is a complex and ever-evolving field, with hormone therapy playing a critical role in the management of hormone receptor-positive breast cancer. Tamoxifen and anastrozole are two prominent medications in hormone therapy, each with its unique mechanisms of action, side effects, and benefits. The choice between tamoxifen and anastrozole depends on various factors, including the patient's menopausal status, tumor characteristics, and individual preferences. Tamoxifen, a selective estrogen receptor modulator, blocks estrogen receptors in the breast tissue and has a proven track record of efficacy. However, it carries a higher risk of endometrial cancer and blood clots. Anastrozole, an aromatase inhibitor, suppresses estrogen production and is particularly effective in postmenopausal women. It has a different side effect profile, with joint pain and bone thinning being common. Healthcare providers play a vital role in guiding patients through the decision-making process, considering the latest research, clinical guidelines, and individual patient factors. By engaging in shared decision-making, healthcare providers and patients can make well-informed decisions that optimize treatment outcomes and patient satisfaction. While tamoxifen and anastrozole are standard options, alternative therapies such as fulvestrant and other aromatase inhibitors may be considered for patients who do not tolerate or respond well to these medications. The choice of alternative therapy depends on various factors and can be discussed with a healthcare provider specializing in breast cancer therapy. In conclusion, the choice between tamoxifen and anastrozole is a critical decision in breast cancer therapy. By understanding the nuances, mechanisms of action, and potential side effects of these medications, healthcare providers can tailor treatment plans that maximize effectiveness and patient satisfaction. Collaborative decision-making between healthcare providers and patients is key to ensuring optimal treatment outcomes and the overall well-being of breast cancer patients.